Hello, in this video I'm going to teach you about standing posture to best create a position with the body to not put strain on the back and also to strengthen around the core and around the shoulder girdle and around the feet and the ankles. So we're going to start off with the feet pointing forwards, hip width apart, and we're going to soften the knees a little bit. So I don't want you to go into a squat. We're not coming down into a squat here. We're just coming into an unlocked position. So from the side, some people will banana the knees back. It depends how much mobility you've got. But in this situation, we just want to come out of that lock so that the legs are a little bit active. You'll feel that these quad muscles start to work just a little bit as you come out of that locked, slightly lazy position there. So slightly bent with the knees. Thinking about the feet, if you lift and separate the toes, lifting up slightly through the arches. If you lift up through the arches a little bit, you'll start to use this little muscle here as well in the knee, the VMO, and we'll start to use the glute muscles, which we'll come on to in a minute. So moving up to the pelvis here, I want you to tuck your pelvis under and then stick it out at the back. Imagine that the pelvis is like a bucket, and we're tipping a little bit of water out of the front, tipping a little bit of water out of the back. I'm going to do that one from the side so that you can see. Tip a little bit out of the back, tip out of the front. And we're going to go through that range just a couple of times to then settle in the middle, and that should usually feel like you're slightly tucked under with the pelvis there. There should be a little bit of action going on in your glutes here, and there should be a little bit of action going on through the abdominals just to lift slightly through here. And that moves me on nicely to the deep abdominals, which is your corset muscle around here, essentially the one that holds you up against gravity and protects the spine. So all we're going to do is think about the pelvic floor. So I want you to think about lifting through the pelvic floor. There should be a sling going from your sitting bones either side, and thinking about front to back as well. If you tighten up through there, but not in a quick squeeze, I want you to think about squeezing to the count of 5. So 1, 2, 3, 4, 5, not fully, not gripping like crazy, just try and thinking about 50%. From there, you've got that tightened, so that should bring in the deep abdominals a little bit because the pelvic floor and the deep abdominals are linked. We're going to think about drawing those ribs down, soften the ribs down here. Some people like to flare out the ribs. That means arching from the back here. If you stand side on to the mirror, you might be able to see whether you're likely to be arching here. You want to just soften those ribs down. For some of you, that's going to feel like you're really slumping forwards if you're very used to being out here. So look at yourself in the mirror. It really helps to just look at yourself side on in the mirror, drop those ribs down, and just check that that feels like a nice straight position, which I'm just going to cover in a minute, how to feel like you're straight. So the ribs melt down. And then through the chest here, we're just opening out. We're just opening through the shoulders, trying to widen through the front of the shoulders there. Thinking about a big diamond on the front here that you want to show off. So that's an opening there. I don't want you to think too much about the shoulder blades at the back. I don't want you to think about pinching those together. Just a light bit of activity going on at the back here, but generally drawing those shoulders open, draw the shoulders down away from the ears. Thinking about drawing the shoulder blades down the chest wall at the back. And then we're going to tuck the chin as if you're trying to give yourself a bit of a double chin, but don't. We don't want any of these. So that's going too far, tucking the chin back like that. So we're just going to slightly tuck backwards, lengthening up through the back of the neck. So imagine through the spine there's a piece of ribbon or something attaching to a balloon at the top that's drawing you up at the back, which is helping tuck the chin there. Now going back to that straight positioning that I was talking about, again, if you come side on in the mirror, ideal positioning with your posture is a plumb line going down from the shoulder, from the middle of the shoulder here, down to what we call the lateral malleolus, which is that bony bit on the outside of the ankle. Now, I'd quite like your knee to join in that line, the hip here, and the shoulder. So as you stand to the side, write to me in the comment box if you feel like my posture does not correlate with that line. So you're dropping down from the shoulder here to the hip, to the knee, to the ankle. Now some of you will find that your hips are too far forwards. You need to bring them back in line. Others may feel like they're slumped too forwards with the shoulders and the hips are too far back. Bring it all in line. Just that simply will get you in line with your posture there. Good. So once we've got all of this positioning and we've got those deep abdominals working in that good position, we need to do a few little movements here. So if we separate the feet just a little bit more, let me remind you, the knees are slightly soft, the bottom's slightly tucked under, the ribs are down, the chest is open, the shoulders are down away from the ears, and the chin is tucked. We're literally just going to sway our hips from side to side. I want you to feel like the glutes is switching on a little bit every time you sway from side to side there. So we're just taking the weight through each leg. Feel the leg tighten up. Feel it take the weight whilst holding that position. So whilst holding the pelvic floor, the lower tummy scooped in a little bit, the ribs are down, the chest is open, the chin is tucked. If we have a movement through this good postural position, it helps to ingrain it. Lay down that blueprint in the brain. Good. Okay, once we've done that a couple of times, we can bring the feet a little bit closer to hip width again. And we're just going to bring one knee bent in front. Now think about what's happening at the ankle here. We're just lifting up that ankle, and then we're lifting up the other leg here. The other leg, the other knee forwards. The ankle needs to come straight forwards as well each time. Recheck all of the positioning. Work on what you feel is more comfortable to you, top down or bottom up. Good. And then we can just change in the air here. Good. If you need to hold on to something here because of balance, then no problem at all. You can have a chair in front of you. You can have the wall next to you there. You can have someone helping you to the side if you need to. Brilliant. Now that might be where you stop. You may not be able to move on to these next stages, but no worries at all. You just keep on going with those. If you can, we can lift up the whole leg, so you can take the weight over just like we have done. Squeeze through the bum on that side. Peel one leg up. Pull the toes up as well. That helps with that chain of activation, pulling the toes up, bending the knee and bending at the hip. Take that foot down. Recognize that you're taking the weight down through that leg, peeling up the other one, trying to keep the hips level, pulling up the toes. Take that leg down to the floor. Good. You can reset yourself, tuck the chin, open the chest, ribs down, bottom under a little bit, take the weight over, peel the leg up. Brilliant. Take the weight over and peel the other leg up. Brilliant. Okay, so another thing that we can do is thinking about just arm movement in this good posture, because of course when we're walking around we need to keep everything going. So just having the feet firmly planted on the floor, we can literally just think about swinging the arms here. So we're thinking about swinging from the shoulders. Allow yourself just a little bit of rotation through here, but keeping this bit still. Good. And you can just breathe along with that. You can breathe in for 5 and out for 5. Brilliant. Okay, so if we add a little bit of the legs in as well, bend one knee and the other arm forwards, we can switch. Trying to hold on to those lovely postural positions, tucking the chin, opening the chest. Keep those hips level. Working those abdominals, thinking about the knees pointing forwards, the ankle pointing forwards. Push down into the heel each time. Good. Just 2 more of these. Wonderful. So, just a quick recap so you remember all of this positioning. Relax the body to start with. Feet hip width apart. Soften the knees slightly, bottom under. Think about that range. Slightly with the bottom under, ribs down, chest open, chin tucked. Lengthen the back of the neck. Think about your plumb line. And there you go. So I hope you enjoyed this video. I hope you found it useful. Remember to subscribe for more useful videos coming out, one every week. and hopefully you want to click like and give me a quick comment in the comment box if there's anything that you are interested in.